Hello, everyone. A very good evening to all of you. I'm Sayuka from All About Skin Wellbeing, and I'm sure all of you must be doing really good. We all know taking good care of our skin is important for more than just our appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is quite common on our skin or nail or many a times on our scalp. Fungal infections are diseases caused by a fungus, yeast, or mold. Mild fungal infections can look like a rash. It can be really itchy and annoying. So it's important to know how to manage fungal infections. So for that, let's connect today with our skin expert, Dr. Shashidhar KC, who's joining live from Davangere to enlighten us on the topic of fungal infections. Dr. Shashidhar is an MBBS MD in dermatology, venereology, and leprosy. He's a dermatologist and have more than 8 years of experience in this field. He completed his MD from Jipmer Pondicherry in 2022 and MBBS from Rajiv Gandhi University of Health Sciences in 2017. A very warm welcome to you, Dr. Shashidhar.
Thank you, ma'am. Thank you.
It's a pleasure to have you with us, Dr. Shashidhar. And fungal infection is quite common. At least the number of patients are continuously increasing of such cases. So it becomes very important to talk about it and spread awareness as much as possible. And for that, we are conducting this session today. And I'm really looking forward to this session because I'm sure with you we are going to know new things about fungal infection and how to deal with it. So start with doctor. What is fungal infection? What are the most risky areas where fungus can grow in our body?
Yeah. As you said, fungal infections are very common. It's something which we see often in our OPD. It forms the bulk of our OPD on everyday basis. Fungal infections, we can say it can affect skin as well as the internal involvement, internal body involvement also can happen. But coming to the see, since I'm a dermatologist, let me speak about. Let's talk about fungal infections affecting the skin. Coming to that, there are various types of fungal infections. So basically what we see commonly is a ringworm infection, which we call it as tinea corporis, and that can involve all over any part of the body can be involved, most commonly the groin area, that is the area between the thighs, and also it can involve the scalp as well and the body as well. Then we have something called tinea versicolor. It's again a different fungal infection, which is characterized by multiple asymptomatic white spots, hypopigmented lesions, which is caused by a fungus called as Malassezia. Then there is another infection called Candidiasis, which can affect the oral cavity commonly as well as the genital part. That is the vagina or the glans penis. It can affect. So the most common one, which we see in our OPD and which is very common among all, is the ringworm infection, which is called as tinea infection, which is caused by a species called fungal species called as dermatophytes.
Okay, doctor. Doctor, we often say that prevention is always better than cure, especially in medical field. And I'm sure there are some preventive measures that we can take to prevent fungal infection.
Yes. Yes, absolutely. Fungal infections are definitely can be prevented if we follow a proper lifestyle measures. As I said, coming to the ringworm infection, basically, it can be prevented by certain lifestyle changes. Basically, the important one is the hygiene. There should be a proper hygiene, like regular shower, taking regular showers, and keeping the intimate area proper clean, and also usage of separate toilet soap, and keeping the area less moist or dry. Usually what happens when there is a sweating or moisture retention, that paves the way for growth of fungus. So we should keep those such areas as dry as possible, and also like proper washing of innerwears, drying it and then reusing it, and also maintenance of personal towels instead of sharing the towels, regular washing of towels, that all has can be followed. Meanwhile, if other thing is like, suppose this fungal infection can affect the foot also. In that cases, after any wet work or after wetting of our foot, we have to keep it dry properly, and regular change of socks has to be done. And the head infection, the head fungal infection, which we call Testinia capitis, in that case, it can be prevented by maintenance of sterility during head shaving and all. So that can be, these are the things which we can follow to prevent the fungal infection.
Okay. And doctor, what happens? I'm sure you will also agree with me in our country because we are so obsessed with home remedies. Then there are so many DIYs, especially thanks to these social media platforms and influencers. They have so much to talk about skin related issues specifically. Then we have these chemist shops, easily accessible, available, over the counter, topical application, and we fall for it. So normally, whenever we are, infected, whatever the infection is on our skin, if there is something which is not normal, we normally go for home remedies. We'll ask a friend or family who had gone through the same plight, or we will go for some over the counter topical application, and we'll keep on applying it for months and months unless and until we realize that this is not working and even making the condition more worse. That's when we actually go and land up in front of a doctor. Though the times are changing, people are becoming more aware, but still, this lobby is also there who's obsessed with home remedies and over the counter topical applications. What's your stand on that? Because my question is basically, do they really work, or they harm the condition even more?
Yes, rightly said. I can say the major problem here in when we see a fungal infection is it's not the fungus, it's the practice, the attitude of people using of native medication or taking the over the counter medications like topical applications from a chemist. What happens is it's a fungal infection. Basically, there is a fungi which has to be treated with antifungal medications, either in the form of cream or the tablet, whichever is required, which can be decided by a dermatologist. But what happens is usually the people try to use home remedies. They try applying irritants like a turmeric or garlic. So all that things are done. Another set of people, usually they go to chemist and borrow some medicines. What the chemist does is usually they give combination creams which do contain steroids. Definitely for any infection, if we use steroids, they will worsen the infection. Along with that, they damage the skin as well, and that in such cases it is very difficult to treat a uh, fungal infection with routine antifungals. So what I say is this attitude of people or the mindset of people preferring the over the counter medications instead of consulting a doctor, and usage of these medicines like combination creams which has steroids and irritants, that will definitely damage the skin as well as increases the fungal infection, and that makes us difficult to treat as well.
Right. So the wisest thing to do is to go and consult a qualified dermatologist rather than
Yes,
falling
yes,
for
absolutely.
all these gimmicks. So what happens, because market is full of products, then we have so many
Mhm.
influencers on various social media platforms, and we get into that trap. But in case you actually want to save your time, your money, your health, please go and consult the right person, which is a qualified dermat.
Yeah.
Now, doctor, because we are talking about fungal infection, when a person comes to you with the signs or symptoms, are there any tests that you normally recommend, or just by physical investigation, you're sure that, yeah, this is fungal infection and, it has reached this level?
Okay. Usually fungal infections can be diagnosed clinically, like when we see a patient, but this doesn't hold good in all the cases. Okay. What happens if suppose the patient tries some irritant application or steroid application, it modifies the picture. So that time it becomes very difficult for a clinician or a dermatologist what exactly the patient had before applying all this. So in such cases, and as well as there are few conditions which do look like a fungal infection but can be other conditions as well. Especially this happens with regards to the ringworm infection and all. So in such cases, we do prefer tests, but most of the time when there is a naive case, what I can say, patient who has not applied any medications, who has not tried any home remedies, comes to us. In most of the cases, when we do diagnose it clinically without any tests, and we give antifungals. If at all uh, there is a proper follow up and the patient has taken treatment and all, even then it is not responding, then we can consider tests. In such cases, tests are required in certain cases, but in most of the cases we do diagnose clinically, like without any tests.
Right. Doctor, can you tell us how does a fungal infection looks like so that people know that, if there is something on their skin or scalp or nails, then they need to go and consult a doctor because the chances are that it can spread from one person to another as well, right? So to minimize
Yes.
that risk, if you can just let us know how does it looks like.
Yeah. Coming to there, as I mentioned in the beginning, there are different types of fungal infections. Coming to the ringworm, which is very common infection, or tinea infection. In that case, usually when it affects the body, like the trunk part or the hands and legs part, in that case what happens, they will usually the patient will have a round itchy reddish patch. There will be a proper border, and in the central it looks like there is some clearing, but there will be scaling. The flaking of the skin also will happen, and it will be very itchy. So usually it's called ringworm because it the rashes appear like a round rashes. And if it is in the groin area, again it's difficult to appreciate scaling, but there will be redness. In some cases it can be hypopigmented, like a dark brown color, with lot of hitching and with the proper border. And coming to the nail, per se, there is again a different fungal infection. We call it as onychomycosis. There will be yellowish discoloration of nail plates will happen, and there will be thickening of the nail bed. Under the nail plate, there will be some thickened material will be there, which is because of the fungus. Coming to the scalp fungal infection is very uncommon usually, but it's common in children. In that case, we do encounter there is a flaking of scalp, usually in forms of patches or the plaques, and there can be sometimes there can be also pus filled lesions can happen in the scalp. So there is another kind of fungal infection called candidal intertrigo, which is very common in diabetics. In that case, usually in between the fingers spaces, web spaces, we call them. So in such cases, in these kind of spaces, there will be redness, and there will be itching, and there can be some kind of whitish scaling can happen. So these are the different features. So whenever you encounter a itchy reddish rash, or a brown colored or hypopigmented rashes, or there is a yellowish discoloration of most of the nail plates, in that case, most likely it can be a fungal infection. So I suggest any patients who develop such rashes better to consult a doctor, qualified dermatologist.
Right. So the bottom line remains that in case you have any, thing on your skin which is not normal, it's bothering you. It can be a rash, it can be itchy, whatever it is. Please go and consult the correct person, which is a qualified dermatologist. Now, doctor, we see a lot of recurrence in case of fungal infection, and a lot of cases of resistance is also being noticed nowadays. What is the reason probably behind it?
Yeah, the recurrence is very common. I go for recurrence is more common than the resistance. So coming to
Hmm.
the recurrence part, usually it occurs because of few reasons. The first reason is when patient stops treatment earlier than the set. Like we do advise patients to follow a certain regimen for a certain duration. There might be early improvement, and because of that, the patient considers stopping the treatment much before than the prescribed duration of treatment. So in such cases, what happens? There is a recurrence. This occurs because if we stop early, what happens? There is something called clinical cure and microscopic cure, microbiological cure. So, clinical cure is something like to our naked eye, the lesion or the fungal infection seems to be cured. It has cleared up. So, to our naked eye. But microscopically speaking, there will be microorganisms still in the skin. So, suppose if you just stop the creams because there is improvement to your naked eye, whatever the existing fungus microscopically present in the skin, they do proliferate, and after few weeks it recurs on the skin and we can see it through our naked eyes. So to counteract that microscopic existence of the fungus, that is to achieve microbiological cure, that is the reason why we recommend a longer duration of antifungal topical application as well as the oral medication, which is not followed by most of our patients. So that is the reason for recurrence. And the other reason for recurrence is the family members when they don't get treated at the same time. Suppose one of the family members had fungal infection, they do take a treatment, but it would have got spread to someone else much before taking the treatment. The other person ignores taking the treatment, the second person. Then what happens is, because of the second person, the already cured first person again gets an infection. This is one of the reasons. So I suggest, like, to prevent the recurrence, any family member with fungal infection, everybody has to be treated. So that is one of the reason. And not following the proper lifestyle measures, so that is also one of the causes for recurrence. Coming to the resistance is the main reason is because of abuse of antifungal medications over the counter without taking it properly. When they take in breaks, like they take it for a week, then stop, then again take it for a week, in that cases it doesn't work. That is one of the reasons. There may be scientific reasons like mutation and all is involved in antifungal resistance, which is a very specific topic. But for the common man point of view, when the reason for resistance, what I can say is usage of all these combination creams with steroid, antifungal, and all the irritant and antibiotic combination creams, or not following the proper regimen prescribed by the doctor, and sometimes unnecessary intake of antifungals also can cause this resistance.
Okay, so now we know that why recurrence or resistance takes place. So the bottom line again stays that in case you have fungal infection, please go consult a doctor and complete your treatment. Trust your
Right,
doctor.
right.
That is really important.
Yeah, and there is
Now,
a need for follow up. The patient has to follow up when at a proper uh, duration whenever the doctor says, like the doctor will be telling to review after 4 weeks. So in that case, the patient has to review whether there is an improvement or not. The doctor will be deciding the continuation of treatment. So that is one
right.
thing.
So keep the doctor in the loop. Whatever you do, please consult with your doctor. That's really important. Otherwise, as we were discussing, there is a tendency, for example, if I'm on medication for 3 months, I'll do it religiously for 15 or 20 days. Then, after seeing some relief, I'll stop it. This is a very common, tendency, but that is not good and that is more harmful. So, please don't do that. Complete the treatment and do the follow ups as advised by a doctor. That's really important. Doctor, normally how much time does it take if talk about the skin fungal infections or the nail fungal infections or the scalp fungal infection? How much time does it take to get back to normal?
Again, it depends on the time which the patient presents to us. Like if it is the patient presents with less number of lesions or limited disease, usually we do find good improvement within a month. Okay, the lesions will resolve by a month. If the patient doesn't allow, like there is a whole body involvement. There are cases we do see patients with whole body involvement of fungal infection, and they do ignore taking proper doctor advice because of usage. They do try to follow home remedies or over the counter medications. So in such cases, there may be requirement of lot of time for the skin fungal infection to resolve. So again, it depends on the severity, the limit involvement. And coming to the other thing is with regards to the nail involvement, the nail fungal infections take lot of time than the skin infection. So whenever there is a nail fungal infection, the treatment definitely requires minimum of 3 months to 6 months. Okay, so again, we the treatment will be based on how many number of nails involved and whether it is fingernails or toenails. Do usually fingernails do respond early compared to the toenails, but definitely the nail treatment will be like it's a more longer duration than the skin infection. Again, the scalp, it also requires a little longer duration than the skin, but lesser than the nail involvement. It does it We need minimum of at least 1.5 to 2 months proper follow up with proper medications for the entire scalp lesions to resolve. So everything again depends on the severity, the patient compliance, and also the response. If there is a resistance involved, again we might have to change different medications and all that. So it depends from so it differs from person to person or patient to patient, I can say.
Right. And what are the treatment options available, doctor?
The different treatment options, I can tell you is again for the skin we have different kinds of creams or ointments. Usually we prefer creams for the skin part. Uh, we have a wide range of antifungal medications which are available topically. We have different medications. We can prescribe it in combination, like a morning different cream, night different cream, or the same cream 2 times, morning and evening. Differs from patient to patient. We can use that. And there are antifungal tablets which are required in case of extensive disease and which is not responding to creams alone. And we have is for the nail infection we have something called nail lacquer, which more or which looks more like a nail polish kind of thing. So that nail lacquer formulations which are required for the nail, because nail is a thicker part. Usually it the creams or the routine creams and ointments may not help. So some for that specifically we have a formulation called nail lacquer, antifungal nail lacquers. And for the scalp we have antifungal shampoos, antifungal lotions are there. And all this will be added up with the antifungal tablets, oral medications. Again, in the oral medications we have different types of medicines. So depending on the response and the severity as well as the geography, like there are it depends. Even there are certain areas where few medications may not work and we have to go for higher end antifungals. So right now, as discussed, resistance is also common. So we have to uh, what to say, we have to consider different options depending on the response and the severity. So there are creams, ointments, lotions, shampoos, nail lacquer, and the tablets.
Right. So when you'll go and consult with your dermat, they'll help you in choosing the correct line of treatment as per your condition, as per the severity, etc., etc. There are so many questions coming up by viewers. I'll take few of them. Rian is here, and the question is: can fungal infection cause muscle pain?
As mentioned, fungal infection is a skin infection. Okay, there are other. We have again superficial and deep fungal infections. Our whole discussion was more focused on superficial fungal infections, which is very common in our country and in our society. So usually, this superficial fungal infection doesn't cause fungal pain. The muscle pain happens say they go for any irritant application, and there is extension of infection to the deeper level, in that case it happens. There are again a set of deep fungal infections which is not so common. In that cases it happens, but coming to whatever we discussed so far, like a ringworm infection or candidal infection, they doesn't cause the muscle pain.
Yeah, and now at least post COVID, we all understand that fungus can be very potent,
Yes,
and
yes.
probably that is the reason people are asking question about the deep fungal infections. But today we are talking about the superficial fungal infection related to skin. The other questions are again, I think, related with the deeper deep fungal infections. Does it affect the brain? Does it affect heart? I'm sure it has nothing to do with the superficial fungal infection, right, doctor?
Yes, yes, okay. Yes,
Okay.
yes. We have again a set of deep fungal infection, as you mentioned. Yes, we had mucormycosis post-COVID outbreak. So we have a lot of fungal infections which do affect the central nervous system, that is the brain, which do affect the muscle, the bone, everything. So which can get transmitted through the blood, spread to the blood through the blood. So that's again a separate discussion and separate topic. But coming
Right.
to the superficial fungal infections, definitely they are skin level, skin deep.
Right. Doctor, one area which people normally don't talk much about is the groin fungal infection in the intimate areas. And people hesitate to talk about it. Many a times they won't come and show it up to the doctor. And that makes the condition even more worse. So, what's your advice on that?
Yeah. Yes, groin fungal infection is very common. We usually commonly call it as jock itch. So it's very common in people who sweat a lot, who wears tight pants, especially the tight jeans. So tight clothing will add up to that, and who do sweat a lot in that case, and who are little obese or fat with the body folds. In that case, the groin fungal infection is very common. What we have observed so far is people try to use over the counter available combination creams in that area, and also which are like easily available. I don't want to name the brands. There are a lot of what to say
Yeah,
combination
let's not
brands which
name
are
them. Yeah.
abused. Yes, yes. So
Yes.
in that case, what happens? The fungal infection worsens, and there may be not only just a skin rash. The patient may develop wounds. Ulcers can happen because of scratching and usage of those combination creams that damage the skin. See, when you apply a steroid towards skin, that area is very sensitive. The groin area is a fold, basically skin fold. In that case, what happens, if you apply steroid even a little amount, the absorption will be more because of the moisture over there. So when it will be absorbed very much more by the skin. So in that case, it damages the skin. So there will be whitening of the skin, and the ulceration can happen, and the fungal infection also will worsen, and that time it is be very difficult for us to treat as well. So people should not hesitate. It's again a fungal infection which can be treated and cured completely. So it's nothing like a lifelong disease. So once you start the treatment, you have to follow it properly till it resolves, and continue the topical antifungal medication for at least 3 to 4 weeks of even after resolution of the rash, and usage of antifungal dusting powders on a regular basis, and along with proper washing of inner ways, and try to avoid, especially the men, try they should be avoiding the v-shaped underways. So that again causes the friction and increases the chance of infection. So we usually suggest people to wear full boxer shaped inner ways. So this is so groin infection is very common, and it can be cured and treated completely. And there are certain lifestyle measures which has to be followed.
Fair enough. Kirti Kapoor is here, and her question is, what is the effect of humidity in fungal infection?
Yeah. Humidity again increases the sweating, and sweating, that is nothing but the moisture retention, that again increases the risk of fungal infection. That's what I can say.
Right. Right. So, people who live in coastal areas or places where the
Yeah.
humidity is very
This one.
high, or those
Mhm.
who sweat a lot, of course, they are at more risk, or immunity also plays an important role, doctor.
Yeah, they are at more risk. It's not like they are like they can't. They have to suffer it all the time. So they have to follow certain change lifestyle changes in such cases when the
Mhm.
environment is very humid and they live in the coastal areas. Try to avoid wearing tight clothing. Tight jeans has to be avoided. Usage of cotton, loose cotton pants, and as I mentioned, usage of this boxer shaped short innerways, along with usage of regular usage of dusting powder and maintenance of hygiene over that particular area, the groin. All this, if we follow, and avoidance of sweating, like even when we sweat a lot, on and off, we have to keep that area dry with usage of proper clean towels. So in all that, if we follow all such things, definitely we can overcome the humidity problem of humidity, and so we can stay without fungal infection even in the coastal areas or areas with high humidity. Only thing is we have to be very extra cautious and adapt certain lifestyle changes.
Right. Doctor, because we are talking about fungal infections, and another very common thing with fungal infection is that it spreads from one person to another. Now, if there is a member in the family who is infected with fungal infection, first thing definitely is that the other member should take him to the doctor, get the treatment started. But what other measures they need to take care of?
Yes, it can spread through close contact, through use sharing of things like a towel or a soap or clothes. Sometimes it can spread even with like when we wash the clothes together as well. So it can be prevented by treating the affected person properly and maintenance of separate things, separate toiletries, like usage of separate towel, separate soap, and washing of clothes separately. And so, all if we follow all this, definitely we can stop getting an infection or spreading an infection from one person to another.
Doctor, those who are diabetic or have thyroid issues or immunocompromised, are they at larger risk of having fungal infection?
Thyroid, definitely no. There is no any data where like thyroid patients are more risk for fungal infection. Diabetes, I can say yes. Again, the ringworm infection may not differ much with the common people in diabetics, but they respond very slow to treatment compared to others. If it is a case of ringworm infection, but the diabetics are more prone for the yeast fungal infection, like that is the candidiasis, especially in the genital area as well as in the web spaces. What happens, the candida, which is a yeast, so that it will be more in diabetics compared to the other. It's a normal commensal, but when it increases, it manifests as candidiasis rash. So that will be more common in diabetics. So diabetics are predisposed for this infection, I can say. So adequate sugar control has to be achieved. And one more problem with the diabetics is they will be on certain medications. So in that, so we have to check whether the oral medications which we are gonna prescribe doesn't have any cross interactions with the diabetic medications. So kind of like we may not have complete liberty to treat them also in certain cases. So definitely diabetic people are at risk for the candidiasis, and they do respond very slowly to the ringworm infection. Then the other other suppressive conditions like immunodeficiency conditions. I think it's more or the same. The problem comes with the response to treatment. They do respond very slowly, and even if it occurs, it may occur in a very extensive scale in these cases. But I don't say that they are very much high at high risk of developing fungal infection. They're superficial skin fungal infections compared to others. So.
Okay.
It's about the
Now, Doctor,
treatment response. Okay.
absolutely. Many viewers are asking if we don't do anything with the infection, no home remedy, no DIY, no over the counter topical application, no treatment, no showing up the doctor. Will it heal on its own?
No, no, there is no chance at all. So definitely no. There are few skin diseases which do heal by their own, but definitely not the infection part. The fungal infection is something which nobody will be having. It's not a normal thing. It's acquired infection. There is extra fungus in our body, in our skin. So it definitely has to be treated. If you don't do any intervention, it just spreads all over the body. That's it. So we have to take treatment for that. There is no chance of self resolution, definitely.
Right. A viewer is asking that many a times, especially if you're living in a coastal area or it's raining or so, the clothes doesn't dry properly. You said that your clothes should be dry. You should use a lot of cotton clothes. What to do in that case? Many times the clothes are a little damp.
Yeah, this is the problem in the monsoon period or the rainy season, that the clothes don't get dry, and people try to wear the wet innerwears, and that again increases the fungal infection susceptibility, and that people come with the fungal infection to us. So in that case, we have to find out measures to dry the clothes. We should not stop washing the clothes for sure. We should be washing the innerwears, whether whatever the rainy season may be. So we have to iron the clothes. We have to dry the clothes, maybe using
Right.
the heat
Ironing
soap.
is a good option, I guess. Yeah,
Yes, yes.
right. Dr. Shashidhar, before we sum up the whole session, any take home message for our viewers, any do's and don'ts that you would like to tell us before we conclude the session?
I think throughout our discussion, we spoke about what not to do and what to do most of the time. So the last question was something which was like unusual, like whether there is a chance that fungal infection can self-resolve. Definitely no. Fungal infection has to be treated, and definitely it has a treatment, and it can be completely cured from our body. We have hundreds of skin disorders which the patient has to suffer lifelong, which though there is a treatment, we can just keep it under control. We can't cure them, but coming to this skin fungal infection, definitely we can treat it completely and make patient free from the infection. So I suggest every patient or any persons who are having these kind of fungal infections which we discussed so far, either in the groin or in the nail, the skin, the scalp, go for consult your nearby qualified dermatologist, take proper treatment. You should be knowing that antifungal medications, especially the topical creams, has to be continued for a longer time, though the skin lesions would have resolved, to prevent the recurrence, and the proper duration prescribed by the doctor has to be continued without stopping the treatment early. And the lifestyle changes has to be followed properly, like the area has uh, the intimate areas has to be kept very hygienic, and separate towel usage of separate towels. Soaps are something which are ignored by many, so that has to be taken care of. Frequent change of towels has to be followed. So all these things has to be followed, and through this definitely we can get rid of these fungal infections.
And ultimately, it's very annoying for the patient who's having fungal infection because it's itchy, and thus it do hampers our quality of life. So don't suffer in silence. Please talk to the right person, which is a qualified dermatologist. Thank you so very much, Dr. Shashida. It was wonderful talking
Thank
to you.
you.
Thank you for making
Thank
the whole
you.
subject so simple to understand for all of us. Thank you.
Thank you. Thank you very much. Thanks for the opportunity. Thank you.
We really look forward to have many more sessions with you on various other
Sure.
topics as well, Doctor. Thank
Sure,
you.
ma'am. Thank
And
you.
viewers, thank you. And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you, and have a great evening ahead. Goodbye.